Time. What can I say? I've been in mental health for 35 years. It's not been an easy road being an art therapist, I'm just going to say. We literally, after 40 years, just got our licensure as independent licensed art therapists. And also the music therapist did too. So the program that I created with Julie Garrison, she is a neuromusic therapist. And we created the 8-week program for post-traumatic stress disorder for military. It's not been an easy thing. We really base that on grants and donations, basically, so that we get paid, but the military people can come there. The reason we did that and not use their insurance, even though I'm a TRICARE provider, which is a military provider, we didn't want to do that because if you are flagged with post-traumatic stress disorder in the military and you have a high ranking secret, status, should I say, you're just medically discharged. Boom, you're out. So we wanted to do this to provide services for people. Julie's husband is a wounded warrior, and so we wanted to do that so that other people could actually get treatment when they're in active military instead of suffering with post-traumatic stress disorder. That's always nice, right? To get treatment, that's always helpful. So now I pulled her in at a place where I've worked for almost, 21 and a half years. I created that position for myself. That's pretty much what us art therapists have to do sometimes. We have to do our own things, just as an artist, being creative and figuring out how can I make money at what I do, right? How do I sell my art? How do I sell these services as an art psychotherapist and be able to help people? I specialize in post-traumatic stress disorder. With children from 3 all the way up to my elderly people. I think the oldest person I've seen is 89. So that's nice. So I have this beautiful office where I have a sink and it's an old x-ray office, which is beautiful because it's those old x-rays. So I have like a light over here in one area where I have a sand tray. Then I have like big windows. That's always nice, right? And a sink. You want a sink, right? As an art therapist, you want a sink. So I got that. I could see outside because I've been in other places where I had no windows. You know how that is, creating artwork. That's horrible. So you don't want to do that. And then I have all this space to put all their artwork in. And a lot of that artwork, so like those little cubbies, the kids always call them cubbies, but I have it alphabetized. So with my children, teens, and adults, I have them put all their artwork there, and a lot of it's trauma, okay? So I'm dealing with attention deficit, I'm dealing with bipolar disorder, I'm dealing with anxiety disorders, I'm dealing with schizoaffective disorders, schizophrenia, and bipolar or depression mixed in there, and a lot of post-traumatic stress disorder. I do with developmental issues as well as schizophrenia and alcohol and drugs, you name it, I've been there. Intensive outpatient programs to inpatient, working as an art therapist. There's different types of stress. So intensive inpatient is that too loud? Oh, okay. It's okay. Yeah, so the inpatient, that's intense. That's very stressful. And I've been there for adults as well as adolescents as well as children and inpatient psychiatric. So doing groups and doing things like that. Where I'm at currently is all outpatient, which I kind of like better. And I basically make my own hours of what I'm doing and how I want to work, which is kind of nice to have balance, right? You don't have to take off any work. I can come here. I just reschedule all my clients for this time and put them in a different time because I'll go back to work after this. So I also created a lot of big works. These are small things. Mine are really big, but I didn't want to drag that in here. You know what I'm saying? They were really big paintings that I have that are mixed media. So I've kind of given you a little bit, just a snippet, I guess, of what I do. And some of these things I've done in sessions, like when I have someone, I'll have them do creative things. So for example, when I'm working with somebody, maybe they have anxiety, okay? I want to know what that anxiety looks like. I want to know what it looks like. I want them to externalize that anxiety. I want them to think about what does it look like with colors, shapes, sizes. I might have them go through a guided meditation first and imagine what this may look like. What does it feel like in your body? What is it? And so then they externalize that. Meaning they'll use like paint or like a lot of times they can use like markers, they can use colored pencils, they can use paint. So these different mediums, as you guys know, they can elicit a lot of different things. So if I've got somebody who's really feels out of control, I'm not necessarily going to give them paint. I'm going to give them maybe they're going to start out with markers. It's very controlled, right? That's a very controlled medium. Or I'm going to have like colored pencils for them, and maybe they're creating that anxiety out of that. Because if they're feeling so emotive, I want to bring them down. And so art therapy, what it can do, and you may know this just with painting, right? Painting can be really relaxing, but it's also very expressive. And for somebody who feels out of control, they may not want to do any painting, especially watercolor. They get really weird with that. So with watercolor, they may not want something that feels out of control. I like to work wet on wet. I'm good with being out of control like that because it's in a contained place. So this is what the types of things that I would do then is have them work in, say, expressing that anxiety or whatever it is. And then we go, and I have music playing or whatever. Maybe I'm doing a painting, maybe I'm doing my watercolor stuff. Maybe I'm doing, these are some of the things that I have at work. It's about that size. Sometimes bigger, sometimes it's this size. But some of these are just done during the session that I'm with my client. Sometimes I'll work right next to them and have just nice music playing. And then I go back and I process through what they created and why they created it that way. What is it? Because of the movement and the shape and how it is. And just as other artists, as you know that if you put out different colors, elicit different feelings, different maybe different modality. I'm trying to think, like different ways that you're painting. I'm an abstract artist, expressive artist, and so mine's just whatever. I just go with color, and I'm just painting in the moment. I don't necessarily have anything there that I'm doing. What I notice, and this is what happens, is this is with art therapy, is that when I'm creating, a lot of times, even though it's very abstract, and I'll stand back and I'm looking at my paintings in my dining room going, oh, there's my trauma right there. Because I'm like stepping back going, that's not what I was thinking about. Because I don't think about it, but that's art therapy. Art therapy is this unelicited, unexpressed, unconscious images, things that come out over and over and over again sometimes if they're not healed. You think, God, I thought I healed that thing, but there it is again. And I see it in this piece, and I see, okay, there's that, there's my lovely anger painting. So I help people be able to take this internal struggle that they have and externalize it into maybe a really big piece of paper that I got on the back of a wall. I have one of my little girls who's going through a custody battle, and she has to go from one home to the next home, and it's stressful. And there's other sisters that are in different homes, these half sisters and those half sisters or whatever. And just the uncertainty of all of it creates a lot of stress. And God, she's good. She put on the little paint shirt. She's going crazy on this, making it very abstract. And she has her little color code. Well, the red is all my anger. All the blue is all my sadness. The yellow, that's my loneliness. All these different things that she has. And it's all being twirled around and it's being expressed. And she does such a great job with that. And then other people, I have Clay that I'm working with my group that I'm doing with Julie. We just started our PTSD group with them. And so I gave them all, we're working on safety and stability. Because we have an 8-week protocol that we created about 6 years ago, and then COVID hit, right? So then we couldn't get that going. And so what we did was the first one we just did last week was taking them through a little bit of a guided meditation and then having them try to reconnect into their body. But if you're traumatized, that's a hard place to be sometimes. If you're traumatized, you're maybe really disconnected with the body. So what we're trying to do is help them connect and express, and where's the pain in the body? Where's it located? So they have like an outline of a body. I'm sorry, I don't have all these up here, but So they'll have an outline of a body, a female or a male body, and it's a mixed group. So there's primarily females and then 2 males that are there too. And they'll go ahead and identify in there, where their pain is, what's going on. And then Julie, that's intense. That's intense work because a lot of times they don't want to be there of whatever's happened to them. Out using when they were out using. They're all sober at this point, and this is another way for them to treat their mental health for their PTSD. So then the music therapist, what she does is she got in there with other music and different things. So basically they were all kind of like, with me, more intense, brought up a lot of emotion, and then she comes in as the neural music therapist, and we work on other issues and other things, and then it brings it all down. So they leave grounded in their body. They don't leave disconnected or disassociated when they leave, because I don't want them getting in a car and drive away like that. That'd be horrible. And so that's one way that we work together. But I want to show you some other things up here. If I can get this to work. There we go. This is a landscape montage. I did this. A lot of art therapists don't do this particular thing. I do. It is an art therapy assessment. Can you see that kind of a little bit? I'm trying to remember back. This was from 2006, so forgive me because I don't know where my little cards went with it. But the landscape montage, there are 10 items that I have people create. Typically, there's a house tree person in it. So there's the house, here's a tree, and here's the person. Oh, I know whose this is. This is from a long time ago. This person is now an adult, probably in their 30s or I don't know, 30, probably 35. So in the landscape montage, I have them draw a house tree person, a mountain, river, road, animal, flower. I'm trying to think what it is. I think that's river, rock, flower, mountains. Oh, and a field. A field is in there. The rock is in there. And those different things, it's based on a landscape. It's more of an Asian thing where they do a whole landscape about their life, and it just kind of illustrates their life. So this is where this comes from. And I like the fact that it's kinetic because it gives me relationships of what's going on. And typically I only have them draw this in pencil, and then if they want to draw it in use a color pencil, they can. It kind of gives me an idea about, one, how do they draw, how do they attempt to do something, developmentally where they are in something, as well as these added components that are in here. I know this whole family. This is very interesting. So the person is out here. This is the girl. This is actually, at the time, I think she was probably 13, 14 years old. There's a lot of chaos that happened in this house because I saw like a couple of these sisters, and another colleague saw the mom. And then just recently I saw one of the other ones who wasn't even thought of, and now she's like 19 years old. So, in a hot mess herself. So interesting with the tree. With the tree, I always think of the tree as, this is the emotional self, which is always interesting, this little hole right here. A lot of people would draw those holes right there, but sometimes they put people in there or animals inside the hole. I always think, okay, what's happened here? If this is the head, these are the body here, what does this look like? It's pretty well established. It's actually green. The whole entire tree is alive. I always ask these questions because sometimes the tree's half dead. You'll see some other ones. And then that indicates more of depression. This kid did have a lot of depression. She actually did have some bipolar disorder, I believe. I'm just trying to remember. But see, she wants to be way out here and away from this house, which I thought was very interesting, is that she wanted to be far away. But all the rocks are about problems. So there's a tremendous amount of rocks there, right? So this kid was in a really dysfunctional, I don't know if I'd say it was abusive, more neglective, a lot of yelling in that particular house with this particular family. And then we've got the road. Where's the road going? It's a metaphor. So art's a metaphor, right? Maybe not your art, but this art is metaphoric. And looking at it as, where am I going in my life? What's my river of life? Where am I flowing? There's got fish in here, that's good. They can actually swim. They're not like drowning. So that's a good thing. And then just the rocky part here, and then the mountains, I always look at it as family members that sometimes you have issues with, or if there's problems with them. There's a lot of mountains too. They had a lot of family members. I'm just going to remember that. And then they added some other elements like a bird. Sometimes I see birds and I always think they want to be free. What adolescent doesn't want to be free? They usually want to be free from their house. So some of this is what I look at. I'm just trying to remember this. I had another one, but I couldn't find it. The house is on top of a mountain, right? Getting ready to crash and burn. So it's interesting of just how someone draws the person, because the person's typically about themselves. Sometimes I'll see perpetrators in these. And then you've got the tree. It does have like a lot of color in it, which is a good thing in comparison to, say, some of my other ones. Like, I'll show you some of these. I'm going to go through all these. I just wanted to give you an idea about what I see. What is that? Okay, this person is no longer alive. I had seen her off and on over 20 years. She had extensive abuse, complex post-traumatic stress disorder, and from childhood on, from a little girl all the way into adulthood with domestic violence and sexual violence and a marriage and all the other things, and some religious abuse, some other things that happened. So this one, she has bipolar disorder, but she was in a depressive phase at this point. And here's her house fully guarded. This is really interesting. Right, really fully guarded right in there. And so just the way she drew this, there's just a lot of anxiety and depression. You can see it, right? The depression. You see that? And just the way that it's drawn. We've got pine trees. This pine tree typically is like a downward motion, and so it's more of a depressive type thing. And we've got one giant mountain. Most likely, I think that was her dad, who was the most abusive alcoholic, addict person in her life. And they lived way out in a rural area, which makes sense, doesn't it? Yeah. We had a good relationship. I really liked her. I'm trying to think, which one is that? Oh, okay, yeah, I know. Okay, yeah, this one is with an artist, actually. This is not her medium. She's a really good artist, though. This is hard to tell in this. She definitely has bipolar disorder. Just as how she's not very grounded, had severe PTSD, although it's very light, even though she used this. I typically wouldn't have people use, this is almost like crayon on here, because typically I wouldn't have that. So I'm going to show you some of these other ones. Okay. What do you guys think? Is it interesting so far? Kind of interesting to see what we do. We've one of the oldest associations in the country, the Buckeye Art Therapy Association is one of the oldest associations that we have. And so a lot of artists, a lot of art therapists came out of the Buckeye Art Therapy Association, created the American Art Therapy Association, and then from there, the American Art Therapy Credentialing Board, which is our national board. And now we have to be licensed here and get tested here. Not me, I got grandfathered in, thank God. So this is a person who had severe abuse, also an eating disorder. This is an adult's drawing. I typically wouldn't do this with children. This is too difficult, too many things to put in if it's like 12 or younger, really, to really conceptualize this whole thing. So she has this son that's, trying to remember what she had said. This is probably 20 years ago. So this son was like really bright and very, almost like an angry son, the way that she had that being created in the house that she grew up in, and the trees that are here. So this very depressive looking tree. And I always look at all of this. What is underneath here, which is, to me, the anxiety that she would feel with the post-traumatic stress disorder. I think she had bipolar disorder as well. So just a lot of things. So from this, what I can do is I usually go through the whole thing with them, ask questions about the house, the tree, every aspect of it, and then gain an idea about what our treatment plan can also be. I do a psychosocial assessment and diagnose as well, but then I can just take this, it validates the psychosocial assessment, and then I do a treatment plan from there. Yay for me. So
what do you say about those single flowers?
The single flowers are always my female. So the single flowers, because I always ask about that, that's the flowers, I have them put a flower in there, and it's usually representative of like a female. Yeah. So, and sometimes they'll say, oh, that's my mom, or that's my aunt, or that's my sister, or that's my, somebody usually close to them. It's not typically a conflictual person. It's usually like just somebody that they have a support. And this flower is kind of like bent over. So there might be sadness for that person too. But like a lot of anxiety, just a lot of anxiety and depressive type stuff, just the way that this is drawn.
Is there anything about the fact that there is no person in the picture?
Good point. There isn't. Yeah, sometimes I'll say, yeah, that's interesting too, isn't it? So sometimes with no person in there, sometimes they're in the house. So they're in the house. Sometimes there's smoke coming out of the house. Sometimes it looks very empty. A lot of times if there's, say, sexual abuse and stuff like that, sometimes, especially with kids, if it's just a house tree person, it's very sexualized drawings. But the person, yeah, sometimes they're not in there. It's kind of interesting, isn't it? They left themselves out. Where am I? Where do I exist in this family or in this system? This one, think medication or non-medication? What do you think? Psychotic, right? Psychotic.
Wow.
So this person is an adult. Hopefully they're not. They may have passed away by now. This was been a while ago. They were in their 60s. So I'm going to say they might still be around. Might be in their 80s somewhere, maybe. I'm not really sure. They all gave me releases of information. This isn't just stuff I can just go and present. So all of these have long release information to have any. These are actually part of a clinical record. That's why I can't just, post their stuff up here. Or I never like it on my walls and things like that, because I feel like art therapy is different than just putting it on your wall. I just did this painting. This is some private, very private stuff we're looking at. So I always feel weird if I'm showing it, but these all have releases, okay? So this is very psychotic. The person is here, very disintegrated self. This person was pretty much, I would say, a borderline personality disorder, which there's a disintegrated self, typically, with a personality disorder. Very psychotic. On no meds, there was no antipsychotic on this, because I mean, she's drawing all this stuff and she's acting out and doing like some of the most crazy things. And I'm like, we need to get you on some medication here, because this is off a wall. So I feel like she was schizoaffective disorder with bipolar mixed in there and complex post-traumatic stress disorder, because of the severity of abuse that she went through from childhood on. And I think, too, some of the things that she had drawn in the past were really archaic mental health institutions and things that happened to her while she was there. A lot of ECT type stuff. Do you guys know what that is? Electric shock. We do still do that today. It's usually done at the hospitals. We have more of a thing called TMS, which is it's transmagnetic stimulation. So it's magnets, not the same kind of thing. You have to have be administered to you. Let me see if this is the same person. That's the same person after medication.
Wow.
And a lot of therapy. Huge difference.
Yeah.
Wow.
Huge. So sees themselves as strong together. And this is medication involved too. Yay. And then this was the animal, which I thought that was interesting. It was the animal, but dragging the tree up. It's almost like a really depressive tree that they're dragging up a mountain, maybe becoming on top of the problems. I saw her for years. And I had a tremendous amount of her work. I think I had her take it all with her. Usually I have a folder that I keep. And then when they're done, I have them take it all with them because I don't want it. I'm supposed to save it for 7 years because it's clinical record. Can you imagine all the artwork I have to save for 7 years? I'm glad I have like a closet, right? So I have to go through it and look at it, and some of it, I have to get rid of. But I do all different kinds. This is just the drawings. This is just an assessment. I work in mask making. I work with clay. I work with fabric. We do coping skill pillows. We've done, I had one of my girls, this was years ago, she's probably adult now. Her mom was in a nursing facility. She was relatively young. She was like in her 30s, but she was in a nursing facility and she missed her mother. And so we made her mother, meaning we made like a doll of her mom so she could sleep with her every night. That's the kind of stuff I like to do. I do a lot of grief work. Where I had the tapestry of grief, and Rosie participated in that one. And that was really cool. I keep forgetting to bring all these things with me, and because they're at my office, and then I don't go there, and I forget about it. But that one was based on, so it was like hanging artwork, and it was kind of like, sort of like this. Now I did this one. This wasn't that. This was something different. This was kids that I was getting. That I had 3 kids for foster to adopt. It was a horrible thing. I thought it was going to be good, and it wasn't. But I had just gone to an art therapy symposium, and they were coming the next day. So this was like a little remnant of. There were 3 girls. They were very, very not well, so they didn't stay long. They were maybe had them for 4 months. So. That their behavior was off the chain. So, but anyway, so that's one of the things. I was like, something for myself. But with the tapestry of grief, it was, I went into like the Art Institute. They had a papers workshop, a paper display. They had all these papers that were hanging from the ceiling and beautifully, they were translucent. And then I was kept tossing this tapestry of grief around in my mind for this workshop. And then I'm like, that's it. You know how you get something, you're like, I know it's going to go with this piece. And basically, there are sheets of wax paper, because God knows I have to, be cheap on a budget here with art therapy as artists, because sometimes that stuff's expensive. And so I liked the wax paper because you can heat it up, you can make texture with it. It's translucent. You can pull as much of it off as you want. And then you can collage it. You can paint it, collage it, put stuff on it. Kind of like this. This was from canvas, though. That was more canvas. But so people did that. So because I always look at grief throughout a lifespan of different layers. You know how we have layers of grief, right? Whether that's marriages, whether that's you grew up in abuse or domestic violence, or there's grief, or you lost a job, or children, or whatever might have happened, then you can have, or a divorce even, divorces, all that stuff is about grief. And so it was a whole bunch of different layers, and then you would, I always like, these are my little sticks. Those are, your little sticks that you can have, that you can eat with, right? Those little,
Chopsticks.
Thank you, they're chopsticks. Sometimes you gotta be creative, right? I only have so much money and supplies I gotta give out. So anyway, so they would be chopsticks, but then the wax paper you would just fold over and you would like heat it up, and then you would have all of it, and then you could decorate it any way that you want. I got bags and bags and bags of supplies of fabric and yarn, and people have given me all kinds of stuff and buttons and do all kinds of different things. But I'm trying to think the other things that I do. I have a sand tray, and I really like that sand tray because I look at it like a 3D moving picture. And it's very interesting how kids, you can tell if they came from a house in disarray, they'll take everything and throw it in the whole entire box. Everything. It's a mess. They'll do it in my dollhouse too, just like that. A whole dollhouse. Oh, where's this? This is at Daddy's house. Or this is at Mommy's house when I go visit. Or this is at somebody's house. And then I'm like, oh, that's very interesting. And then they'll put different, they just do different things in there. They have wars in there. Some, little boys do a lot of wars and all kinds of different stuff. That's normal stuff. Some of those things are just developmentally really normal, the things that they do, and some of it's really off the wall. So, I think what else they do. Puppets. I work with all kinds of different people and things, and it's kind of a good thing. With the IOP, with the drug and alcohol, I'll just give you an example of what I did there. So I always ask what that team, the drug and alcohol team, wanted. We have 10 sober living houses in Dayton. This is with wellness and community care. We're right off of Woodman and 35. And so this is people dealing with addiction and also mental health severity. And so they have a place to live, but they have to be completely sober. They have to come from like a 30, 60, or 90-day program where they're already detoxed, and then they need a place to stay. And so they have that. And then, so we worked on their anxiety. What did it look like when they were out using? What did it look like? What was your anxiety like when you're out using? And they created a thing. Then I took them through a guided meditation and helped them with mindfulness and diaphragmatic breathing and releasing and grounding and doing all that. And then coming back and then doing that anger. What is it now? What does it look like now? Or what does their anxiety look like now after doing that guided meditation? It's pretty much a dichotomy between this and this, which is a nice gauge to kind of show themselves and also others to see how far they've come. So it's really nice to be able to do that and go, look, here it is. Here it is. I'm trying to think what else. Did one on powerlessness. That was on step 1. And I had them do a mandala. You guys familiar with mandalas? You know what that is? So anyway, I just did a big circle right on a page. And so in the inside is what did I have control over? Images. And on the outside, what did I not have control over? What am I powerless over? And then what are the things that I need to do to gain power in my life? And so they did that. So it was really, really good, the things that they did with all of it. I don't know, any questions that you guys have? Yeah.
Do you have a benchmark as to know when these patients are healed?
I don't know if I'm going to say they're healed, but
Well,
progressed. Usually when, they're doing well in their life, like in all areas, because I'm talking to them throughout the whole thing too. They'll have time where they're doing it. It's very quiet. I have music playing, whatever's going on. And then I talk to the parent or I talk to them like, you've been doing really well. You've not been in the hospital. You're compliant on medications. Everything seems chill. Everything seems good in all areas. And it's over a period of a few months that I want to look to make sure that you're really stable before we cut you loose. So I might see somebody in an outpatient setting weekly, or I might see them every 2 weeks. If it's 3 and 4 weeks, it's more maintenance. And so it depends. That's a good question. Like how sometimes you don't see it way over here because they're like, they get mad at you for whatever reason, they take off, or they just stop coming, life gets busy, or they no show and keep canceling. So we're done. But for the most part, I do see kids, like if for kids, whatever they came in with, like if they're acting out a lot, there's tantrums, they're having problems sleeping, they have depression, they have panic attacks, this kind of thing. Those things have really decreased. And it's by us talking through them, talking with the parent or talking with, if it's the parent who's the client, how long has it been? Oh, it's been this. And so when I say, give me a number between 1 and 10, 10 is the highest with the anxiety, and they say, oh, it's this. Oh, and here's my image that goes with it. Here's my 10. Okay, now here it is. It's now a 2. Okay, so how long has it been like a 2? Oh, it's been this long. It's been 6 weeks. It's been, because it'd be consistently having this calm thing. There's not a lot of drama going on. Now, sometimes I got very chronic people in mental health sometimes. And sometimes I've seen them for years and years. Those are my adults typically. Yes, and so really we're maintaining having them just stay out of the hospital, right? And so it does. So I like to get their artwork out and have them look at it and go, let's look at it. Let's see where we're at. Let's see where we're at. Or have them do, instead of this montage, instead of say this, you can see that was later, right? I mean, that wasn't just overnight. This person we worked with forever, and it wasn't just me. I did the art therapy. There was another therapist. We had all kinds of stuff going on with her. So we did like a mini IOP, like an intensive outpatient program for her. So it just really depends. Depends on where they are. Unfortunately, some people aren't getting better. Okay, they just get as well as they do, and some people literally either can't, won't. This is as good as it gets, unfortunately. Some people, that's why I like working with kids, because a lot of times they're more resilient, sometimes, and you just see things getting better where there's no tantrums anymore. Things are different, they're just better. Any other questions?
I just wonder the scope of your practice. You mentioned getting the one schizophrenic person on meds. Do you prescribe?
No, I can't. No, that's a psychiatrist.
Yeah.
So a master level therapist can't prescribe. That's a good question. We have clinical nurse practitioners who prescribe meds that's their areas is psych. And so nurse practitioners can do a lot of different modalities or a lot of different practices.
So you have like a group.
I'm working in group practice.
So you'll discuss patient B, and I think this is how he's going. Then they'll say,
well, yeah, and I'll tell the patient, like, hey, I think you need, because I'm always looking at meds anyway. I want to see what you're on. I want to know what's going on. I want to know what's happening. And if it's an adjustment disorder, no, I'm not going to have people go get meds. If it's something that's been chronic, like some of my teams that have been chronic for years and years and years and years and years, or they're going through really stressful times, COVID really did a number. They're developmentally behind by many years now, unfortunately. Mental health was like bleeding out, and now it's just overcapacity. It just is. We didn't have enough people then before COVID, and now we're just bleeding out completely. So, it's just one of those things. So it just depends. But we have I'm in a practice with a lot of psychiatrists, and yes.
So how do people get your services? I mean, you said that you do a lot of military, but like a civilian person, if you want it, is it through a psychiatrist, or you have your own clinic, or
this is an outpatient. So I'm one of the staff members. I'm contractual at a place, and they're referred to us from hospitals, from schools, from hospitals, from the psychiatrists that we see. They come to see the psychiatrist, and it's like, oh, we want to have you go see Lana. Or there's a school counselor that knows me, or their insurance, because I'm on insurance panels too. So that was one reasoning to have more independent license, because literally the only reason I see clients is because I have a license for insurance, unless they pay out of pocket, right? So they could. I want to do studio art therapy, where I have I'm on a wait list right now for downtown Dayton's their lofts down there, you know what I mean? The artist lofts down there, waiting for that, so I can do studio art therapy, and then people just pay me cash check or charge, I guess, you know what I mean? So, and I've done that before. So, does that answer your question?
Yeah, I was just like a lot of people with mental health problems have no money. So,
absolutely, that's why I'm a Medicaid provider. Yeah.
Okay.
Yeah, I'm a Medicaid provider. Absolutely. Right.
And they have doctors that usually don't know about art therapy or touring.
All of ours do, yeah. Well, yeah, because I'm there, right? I'm there. I've been there a long time. There actually is a lot of doctors that do know about art psychotherapy. I don't know. We've gotten absorbed, unfortunately, but a lot of art therapists across the country now are independently licensed. We did that because there's a lot of people out there who try to promote themselves as art therapists and actually have absolutely no training or credentials to do so. And so that is really not good for the public. That can be really detrimental if you do not know what you're doing, especially when you're dealing with trauma. You have no idea what you're doing in trauma work. You can really, really be detrimental to someone. Absolutely. Yeah. Any other questions?
So you said you have another person who does more of a music?
Yeah,
You
she.
do the neural art?
Yeah, here's the thing. Yeah, so I guess you could say that. So here's the thing with art and music therapy. We go to different parts of the brain, right? So that we're one of the forerunners for post-traumatic stress disorder because we can access different parts of the brain that regular talk therapy does not. Actually, if you talk about trauma over and over, that's traumatizing as in and of itself. So if you're able to do it in a different way and we can bypass and actually access areas where maybe you didn't even know that this had happened to you. There was things that I found out that I didn't know that happened to me just a couple years ago. And I'm like, oh, this is interesting, and things come out. And that's why I did this, and this.
Yeah.
And there it is. And also if there's traumatic brain injury, we are recreating new neural pathways in the brain with music and art therapy, which is kind of cool, don't you think?
Mm-hmm.
We're regulating the nervous system as well. So when you're getting emotions out, like anxiety or whatever it may be, I might do a collage. I do a lot of collaging. So I might do a family collage. I might just go and do a whole collage and pick out you can't really find that many magazines anymore, right? There's not that many magazines. I got some really old magazines. So I'll have a whole bunch, and I've cut all these things out anyway, like for my clients. And they'll do a lot of imagery. I'll do imagery for myself and go, oh, there it is. There it is. And then it brings up all the feelings for myself, and I know how to process that, but other people may not. It's different than journaling. Sometimes you can paint with the other hand and access that way, right? Access with the other hand and access different things. Or I combine journaling with both hands. There's a PhD art psychotherapist, Lucia Capuccione. She has done this whole thing where you are journaling, you answer with, you're like saying, okay, what's going on in my body with your dominant hand? Say you have an image that you created, and then you answer with your non-dominant hand and then go back and forth with it. And for me, that's really powerful because it brings up a whole bunch of stuff of myself going, oh God, there it is. That's what it is. And then you're able to have this emotional release with it. You can. I've done it with, doing it with the other hand and doing artwork and painting. I have a continuous line, and then a lot of different things come out with that too. So it's interesting. There's a bunch of different. Does that answer your question?
Yeah.
Yeah. Okay. Yeah.
I mean, I've seen that neural art done.
Mm-hmm.
That style. So I wasn't
Right.
sure if that's kind of what you do with.
Yeah. It's hard to describe sometimes because it's. Let me take a picture of your art. It's not like people go into like a regular therapy, group and go, well, let me take pictures of what you're saying. You know what I mean? You and this dude. So it's not like you can really go do that unless we do it like, you can't see the person is from the back and you see this, they've given you permission with the release of information to actually, show their work up here. Yeah. Any other questions?
What's that?
Oh, what's this? I am going to do a little demonstration. You want a demonstration of something here? Okay. So in one of our conferences, she's a really good art therapist. She's everywhere with her stuff. I can't remember. I'm trying to think of her name. Anyway, we were doing a workshop with her, and it was about childhood stuff. And so basically, this is partially done.
If you lay that on the table,
You can see it?
Yeah.
Okay.
So put it where your computer is.
Oh, I thought I can't.
No,
It says
no.
right here.
No, you're correct. We just need to flip it over to the.
Okay,
to
just flip it. How do you do that?
And we have a lovely IT person here.
Yes,
who's gonna-
I'm glad someone knows what they're doing with it.
You're gonna put it on a different HDMI, right?
Yes, essentially a different input. Yes.
Yeah. Lana, are you familiar with the woman who wrote, she was pioneering in using the left side of your brain, and
Drawing on the left side.
yeah,
Drawing
Betty
on the left
Edwards.
side.
yeah, drawing on the left side of your brain. Have you heard that title?
No, that's interesting.
I would think that it would be right up the
Yeah.
angle where you're going.
Yeah, thank
You've
you.
heard of it, Teresa?
Yeah, oh, yeah.
Oh,
You
nice.
know the
Oh,
author's name?
I don't.
It's in my life.
But it goes through all lessons that you go through on drawing on lessons. It has a whole program you go through.
Oh, I got you.
You draw with your left hand and you draw
Right.
paper upside down.
Oh,
all
okay.
that
Yeah.
kind of stuff.
Oh, that's interesting. Because sometimes there's where, like, say someone draws something and then you go, okay, how can you change the drawing? How does that feel? Oh, it feels like this or whatever. Maybe it's an issue or something. Like, I want you to think about this issue that you're having conflict with, and I want you to create an image about it. And then when they're done, okay, so now what are you going to add to that? How can you change this to be more comforting? Like, I do a lot of child within stuff, and how can we do a little person or change things or have it be comforting? What would make this more comforting? You know, or create your safety, like for trauma victims. What's the safety? Okay, let me do this here. So this was so you had paper and I'm trying to remember what this was. So there was images that we put underneath the paper, and then there was white paint that I put all over it. And then you had certain places that were uncovered, that you covered and then that you uncovered them. So in art therapy, what I like to do a lot of times is if there's many layers, what are we hiding? What are we not wanting to look at? What do we want to look at? What's unconscious? What's coming up? What needs to be protected? What needs to be changed in a drawing or a painting? And like for this, I'm trying to remember which is which. I like this. I think this is it. This is my bleeding art tissue paper. I don't know. As an artist, it's not like I'm like the neatest person. I don't know about you, but usually I have artwork everywhere and things are. I'm not the neatest person. I am in my office. So I like this bleeding art tissue paper. This already has different layers of stuff on it, and so with this, I like to pull out a bunch of different things that I can put in different places. I like really bright paintings typically. And I like to coordinate like different things around them. And unfortunately, I do use a lot of acrylic. I know you guys are watercolor, and this is tempera, so I'm not trying to, normally I don't use this type of cheap paint, but I do like, it's like whatever's gonna work, right? Whatever's gonna work, who cares? And then I like the liquid watercolor, but so then I'm usually just like painting over it and then getting it wet. I like to work wet on wet. Anybody else like to work like wet on wet?
Yes.
Okay, I like it bleeding, I like it smearing, I like it going everywhere. I like it to see what comes out of it. It's always to me like really exciting what comes out. I haven't yet, I need to use like, what is it? It's not polyurethane, but it's the
Varnish?
I got kind of like a varnish, but epoxy. I'm gonna try to. That's one of my another things I'm gonna start doing, but I like epoxy. So it'd be using different paints. You guys are probably knowing this, and I just like doing different layers of different things that come on here, and I like how everything just kind of moves. And this was just cardboard, I think. Just trying to find. I like working big. I usually sit on the floor, have my hat, like one of my little paint hats on, and then I have my garb that I'm wearing, and then I jam some pixie music on there, whatever it is, some band, and then I just go to town typically and paint all over the place. But or go outside. Yeah, so I just like doing. Can you see it? Mm-hmm. I like using all different types of media and fabric, and I know that you do too.
Mm-hmm.
Yeah, so it's kind of an interesting thing. So It's weird having a whole audience watch me do art. I remember doing a lot of it when I sat there every weekend at that gallery that I had to work. That was short-lived. But anyway, so you kind of get the gist of this, but, and I like doing this kind of thing, but I like putting it together and making something, and then it's, whether that's covering stuff up. I like when people do collaging and mix these different things in here. I like to see how something is layered together and what's kind of together, what isn't together, what is being covered up. And these were some things in childhood that I liked that just kind of reminded me, some images. So I don't know if you guys have images that you might have that you had for a long time. Maybe it was a doodle that you had over and over and over and over and over again. That's significant when there's images that you have over and over again, because it's a symbol of yourself. It's something that represents you, that only you know what it is. I would do this tree kind of a thing, or this one, I don't think I have anything here, but it's like a tree with a lot of different little limbs on it and everything. Well, it never had roots. You want to know why? It didn't have roots because we moved like every couple of years. Not because I was military. My dad worked for NCR. So we moved every 2 to 3, 5 years. So I was a potted plant, right? I was a potted plant, and it took me the longest time to figure all that out. I had no idea, what was happening. Because now I got roots. Since I've been in my house since 2001, I haven't moved from there, been in that same area of all places in Dayton, I don't know, since 1994. Oh my God, that's a really long time. But anyway, so as you can see, it kind of does this whole thing, and you can do, it's kind of an interesting, it's almost like a stained glass kind of a thing. Now, my cheap days, right, here's my Mod Podge, I like this stuff, but it can, I think after a while, this can get too yellowing, I like the high gloss that goes with it. It will go on like really milky, but it gives a nice little shine to everything. I like that. But and then it will dry very
You can put that over wet?
yeah. Or you could let it dry and then put it over, But I like how that, it'll come out looking let's see here. So it's on here. Yeah, so it's on here. And these were quick and done stuff that I did. You can kind of see it, just like a shine. I really like that because it kind of has a cool thing with it. This obviously does not have that on there. I mean, these were just done with the cheapest paints ever. That's what I like, right? Cheap is good. Or donated paint. Hey, that's even better, right? Because paint is expensive. But yeah, so I like I like that. And then the different papers that I've used. This was from a long time ago. These are fiber paper type things. And I've pulled some of them off and put them back on. I like texture. This has fabric in it. Right, that was done when I was working in a wine. No, there was a winery, and my sister and I were out, and I can tell the difference because it's very watery, right? It's I have a buzz going on when I was doing this one, but anyway, I remember this one. Yeah. So and then this is like the wet on wet. This is the ones I like too. It's in my bathroom, but I have huge paintings. My grandmother has amazing paintings as well. So does my sister. Her and her oils, and she's in the mountains. And do you have any other questions about this?
Do you use matte medium sometime, because that doesn't yellow?
Yeah, we could do that
And
too.
it would be clear.
It'd be clear.
It'll dry clear, and you can get gloss or non-gloss, but it doesn't yellow like the Mod Podge.
Thank you. See, there's always good things. Yeah, that's why I want to do the epoxy, because I really like the look of the epoxy. Yeah, it's thick and it's like just very durable. And I like something that, just really can seal in something and give some protection, I think, for all of that. Yeah. I'll spray stuff on things too, but yeah, just like little, yeah, so just like, I like just doing this kind of creative process and how it comes out. Yeah. Any questions? Any other questions?
Just a curiosity, when you look at a show,
Yeah.
is your mind going through the different pieces
Oh,
from the seat of you being an art therapist?
I try not to. I really try not to, because I'll tell you what, when I'm in a symposium or something like that, it makes me really paranoid actually, because I'm not a drawer. And so then we'll have to do some drawing, like those assessments or something like that. And I'll think, don't look. You know what I mean? Because like a lot of times I have to think too that when I'm in those things with other artists as well, everyone has their own different mediums that they do. This is my comfort zone. I like this really like organic kind of cool thing that just kind of evolves into whatever. Other people are very fine artists that do all different kinds of drawings and different detail, and the detail oriented would drive me cuckoo. But everybody else likes it, right? I mean, it just depends on what you like. And there's nothing wrong with any of it because it's art and there's no mistakes, right? So it's really kind of a cool thing. I mean, I remember the art teacher, one of my professors going, "You'll just never make it as an artist. And then you're never," oh, she was horrible. And then she was so terrible. You could do it as design, I think. You could be, into like, material design or what. I'm like, what? And so don't ever tell anybody that. I mean, please don't tell, because I think everyone is creative. And as an adult, especially working with adults who hadn't worked in artwork for forever and a day, they get very nervous about it and how to approach something. And I can't be, I mean, it's very interesting, all the self-talk that I hear before I'm asking them to do certain things, and to even get them to a table. There's people I'll never do art therapy.
I can't draw.
Right, I can't draw.
do that.
I can't do that. I can't do this thing and this, and that's okay. Nothing is. So I'm like, look, you've got no judgment here whatsoever, because I'm not a drawer. I mean, it takes me. It's a lot of effort, is what I'm trying to say. It's like reading or something. I don't really like doing it. You know what I mean? It's one of those things that takes a lot of effort. I like to read, but it's like one of those things where I have to be very interested in it to do it, or do the drawings. I've done all those things. I had all those classes and did all that stuff. But
Look at the detail in that man.
yeah,
That's amazing.
it is. So all the things that people do are really, everybody has a different way of expressing themselves, and it's fantastic. And some are just, everyone has their own thing. So when they say I'm not an artist or I'm not this, I'm like, well, what are the kind of things you like to do? I like to do woodworking. I like to see your woodworking. And it is magnificent. Or whatever it is that they do. There's sculptors. There's, whatever. They just do all kinds of things. All the kids that do anime, and they bring in all their anime and all their things, and I love all of it because I think it's so creative and so amazing to me. So I like all of it. I don't know. Anything else? Any other questions?
I think we're good.
Were we good? Okay. Was it all right? It was okay? Okay, good. Oh, no, I'm not analyzing a thing.